Have you been living with pain for what seems like forever? Have you seen countless doctors, chiropractors, physios, massage therapists, acupuncturists, energy healers, and osteopaths? Have you had x-rays, ultrasounds, MRIs, and CT scans? Have you tried prescription meds, ointments, as seen on TV machines? Have you tried eating certain vitamins, certain foods, and everything your neighbor's aunt's friend suggested? And yet, you still have pain. Today's video will go through why chronic pain exists and, more importantly, how we can learn to live with it. Welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips for living with chronic pain so that we can all benefit in our own personal journey to better health. Chronic pain is a complex topic. Let's start by talking about the purpose of pain. It's simple, right? Pain lets us know that something is not right with the body, that there is some form of damage or injury in the body. Well, it's actually not that straightforward. Yes, pain can be a warning that damage is occurring, like if you touch a hot stove, the pain in your finger will make you pull your hand back quickly. Or if you pull your hair too hard, it will start to hurt to warn you to stop before some more serious damage occurs, in this case, a bald patch. Pain is also telling you that something has not healed adequately. Think of how it hurts to put weight through your foot after an ankle sprain. But pain can also exist long after an injury is healed. And the opposite is true. Major health problems often aren't painful. Many people don't feel pain from large cancerous tumors until the final stage. Some people don't feel pain with heart disease. Did you know that 2/3 of fractures in your spine from osteoporosis go unnoticed because they're not painful? How can a literal broken back not be painful? Half of the population have x-rays and MRIs that show herniated discs and degenerative discs, but don't feel pain. Since degeneration of discs and cartilage can occur slowly over years, your body doesn't perceive it as a threat, and therefore you don't feel pain. So why does pain last even after an injury has healed? In general, the time frames for healing are wounds 4 to 6 weeks to heal, bone 4 to 6 weeks to heal, muscle minor strains can take 2 to 4 weeks, moderate strains can take 2 months, and a full tear that may require surgery can take 6 to 9 months to recover. For ligaments, that's the soft tissue that joins bone to bone, a mild sprain can take 3 to 4 months, whereas a full tear can take anywhere from 1 to 2 years to heal. And tendon strains can take 6 to 18 months, depending on the severity. Disc bulges or herniations take an average of 6 to 8 weeks to resolve. These timeframes depend on your age, the severity of your injury, your previous medical history, general health condition, physical activity level, and occupation. Pain can also persist for other reasons too, like financial or job stress, emotional stress, post-traumatic stress syndrome, childhood trauma from negligent or abusive caregivers, marital or relationship issues or abuse. In a way, chronic pain can be like the physical manifestation of prolonged disabling grief after the passing of a loved one. Now, if you've been having pain for years and the injury has healed, then it doesn't quite make sense, does it? Especially if you've gone through various treatments and had a thorough medical exam to rule out any other serious issues. One reason that you may be having persistent, unexplained pain is that your pain sensing system itself has become faulty. Probably the hardest thing to do is to stop looking for the reason. Stop focusing on fixing or getting rid of the pain. Stop limiting yourself because of the pain. Stop being afraid that you will hurt yourself. Stop waiting until the pain goes away before you start living life again. This is all easier said than done. Instead, practice refocusing on ways to achieve mobility and function. You may find that once your focus has shifted, your pain sensing system will gradually revert back to normal. Think of how a mosquito bite can be so itchy, and the more you try to scratch it, yes, it does feel good, but the itchiness keeps persisting. Only once you're distracted does the intense itchiness go away. Again, that's easier said than done, and that's why you need to take baby steps. It's really hard to break that aversion to pain. For some people, Even the thought of doing an activity like bending down can trigger an electrical shock sensation down your spine. Think of retraining your brain the way exposure therapy or desensitization therapy works. This kind of cognitive behavioral training is used to help people with phobias or intense fear to gradually expose themselves little by little until they feel less anxious. For example, take someone with an intense, paralyzing fear of heights. Maybe they had a terrible fall that traumatized them. Maybe they had parents who expressed excessive fear and were overly cautious about physical safety. Exposure therapy might start with relaxation techniques, visualization of small heights, and then maybe move on to virtual scenes of heights. Then perhaps starting with looking down the stairs, then a hill, climbing up a ladder, then crossing a bridge, and so on. Does their fear of heights ever truly go away? Probably not. But the point is that they've learned ways of coping so that they can function. They will probably never feel comfortable enough to skydive, but at least they can play with their kids on the park structure or go up on a ladder to change a light bulb. Your past experiences with pain may be sending your brain into a panic. It's as if your pain sensing system goes into a full-blown panic attack for movements or pressure that should not cause tissue damage. Your pain sensing system has lost its ability to determine what is harmful. It's as if your pain sensing system's volume control is always on maximum and turns on with a motion sensor with every movement you make. So now what? Well, this is where some cognitive behavioral therapy comes in. Cognitive behavioral therapy is a way of thinking that reframes your experience that puts you in control. There's no doubt that when you have intense pain, you become stressed, fearful, and anxious. And when you are stressed, your pain can skyrocket. Reframing your thoughts can turn you from feeling powerless and abandoned to taking action. Basically, we want to avoid those spiraling negative thoughts because it doesn't help with pain management. Negative thoughts lead to irritability, bad temper, and depression. We end up avoiding activities and isolating ourselves. Some types of unhelpful thoughts include, number 1, catastrophizing, which is thinking about the worst case scenario or believing that you are in the worst possible situation. For example, when I have pain, I can't do anything. An example of a more helpful thought could be, even though my pain is bad, there are still things that I can do. Number 2, emotional reasoning, which means that believing how you feel is the whole reality. For example, I feel useless when I have pain, so I am useless. A more helpful thought is, even though I can't do what I used to be able to do, there are still other ways that I can function. There are other strategies I can use to get things done. Number 3, ignoring the positive and only focusing on the negative. An example of ignoring the positive could be thinking, it doesn't matter if I can do it because I'm still in pain. A more helpful thought could be, doing more is important so that I can continue to live the life I want. Number 4, jumping to conclusions, which means you make negative conclusions based on things that may not be true. A good example of this is thinking, when I bend over, my back is in excruciating pain, so it must mean that I'm hurting myself more. A more helpful thought is that hurt doesn't always equal harm. It's that overly sensitized pain sensory system kicking in. Number 5, all or nothing thinking is when you always think in black or white or right and wrong rather than in shades of gray. Instead of the negative thought, I can only be happy if I don't have pain, it is more helpful to think, even though I am in pain, I can still be happy. I can work on having a better quality of life. Number 6, should thinking is when you feel something should, must, or has to be. For example, my doctor should be able to fix me. It is more helpful to think, There's no cure for chronic pain, but I can practice coping strategies. Number 7, and finally, overgeneralization. This occurs when we see one or two bad events as a complete failure or that your efforts are futile. An example of a negative overgeneralization is, I tried doing this exercise, but my back was worse afterwards, so there's no point going back to therapy. A more helpful thought is, exercises are hard and can hurt at the beginning, but it will get easier and less painful if I keep trying. Here are some phrases that you can say to yourself to help you cope with pain. Number 1, this pain flare-up will pass. Number 2, I can handle this. Number 3, I have pain, but I don't have to suffer. Number 4, how can I model coping strategies for my kids? Number 5, I can focus on something else. Number 6, I will think about what I can do, not what I can't do. Number 7, I've gotten through this pain before and I can do it again. And number 8, there may not be a cure, but that doesn't mean I can't live a great life. It can also help to research role models who have also experienced chronic pain or significant disabilities, but were able to focus all their energy into achieving greatness. It's obviously not easy to deal with chronic pain. Only you know how bad it feels. But there are people who can help you cope and help you with pain management. Find yourself a great team that can include a compassionate doctor, therapists like physio, acupuncturist, massage therapist, social worker, and psychologist. Graciously accept help from others, even if it's in the form of kind words, a friendly ear, or someone who helps carry the groceries. And be compassionate, loving, and encouraging to yourself. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.